So without any further ado, we will go through. We've had a couple of questions that have been sent through already, so we'll start with those, and then we'll go through anything else that comes in. So was there a question that you wanted to go through first?
Yeah, definitely. So, Katy, we've had a question in from Joanna, and I really like this question, Katy, because we've had so many, we get lots of questions about this on the helpline, and Joanna's asking, is it safe to have topical estrogen if you're on AIs, so AIs being aromatase inhibitors?
And that's a really good question, and you're right, it is something that we do get quite a lot on the helpline. So topical estrogen is usually prescribed for people that have vaginal atrophy or thinness of the vaginal wall, and that can happen at menopause. We do know that for people that have had a diagnosis of breast cancer, HRT and hormones aren't usually recommended. And for somebody that is on an aromatase inhibitor, which is reducing the amount of estrogen in your body, it is something that normally wouldn't be recommended as a first-line treatment, certainly. So it's something that sometimes people that are on tamoxifen, which is another hormone therapy, your oncologist might discuss that with you, because that works in a slightly different way and it blocks the estrogen, whereas the aromatase inhibitors reduce the estrogen in the body. So ordinarily it wouldn't be prescribed. But that's not to say that there isn't some room maybe for a discussion of other ways that you can treat that those symptoms. So there are non-hormonal creams and moisturisers that may be recommended, which we've got a lot of information on our website about. So it's worth having a look on our website about that, about managing sort of the symptoms of vaginal dryness or menopausal symptoms. It comes under that. And if your symptoms aren't resolving with those, then please do go back to your team and have a talk to them about it. It might be that they say, well, we'll switch you to tamoxifen potentially, and then you can try it with that. Or they may talk about referring you to the menopausal clinic to discuss any other ways that they might be able to manage those symptoms for you. So, Joanna, I hope that that does answer your question.
Yeah, thanks for that, Katy. And I think what we're seeing, aren't we, in the helpline and everything, that we were more aware, I think healthcare professionals as a whole are more aware of the potential side effects that this medication can have, because it really can affect your quality of life. So it's really important, isn't it, to talk about it and get some advice.
Yeah, don't put up with it.
Yeah.
No, definitely do talk to your team, because there are things that they can talk to you about, and there are creams and treatments that hopefully will help you manage those symptoms.
Absolutely. Thanks, Katy. Well, we've had a question in from Kate, and Kate is asking, when can I stop wearing a post-surgery bra at night after surgery?
Oh, and that's another really good question. And Kate, that depends somewhat on what type of surgery that you've had. So certainly people that have had breast reconstructions, and there are different types of breast reconstructions as well, often they are recommended to wear bras at night for a number of weeks, and that is often down to the type of reconstruction you've had, the type of surgery you've had, and also what your surgeon's preference is. So I think it really does come down to talking to your treatment team, talking to your breast care nurse and your surgeon about what their recommendations are. And also some people that have had not a reconstruction but have had a wide local excision or a lumpectomy, they're sometimes recommended that they wear a bra at night as well to give you that extra support. And it also depends on where the incision, where your scar might be, your wound might be, and also the size of your breasts, because if you've got slightly larger breasts, it may be that it's much more comfortable for you to wear a bra at night to gain help with support and to help with comfort, but also to relieve the pressure on that incision in the immediate post-operative period. So if you are advised to wear a bra, I think there are lots of different things that you can look out for and what type of bras to wear, and we have again information on our website about that. But supportive bras that cover the whole cup of your breast are good. Often soft bras without seams can be much more comfortable, natural fibres. Try to avoid bras with wires in the first sort of post-operative period. And some people find it more comfortable to wear bras that fasten at the front as well in the beginning, just while your arm movement, and they may not be quite as good as it will become, But it might be easier to do your bras up at the front in that period of time at the beginning. But I think really talk to your breast care nurse and see what your surgeon would recommend for you in those circumstances.
That's really good advice, Katie, isn't it? Because there's no really a set rule, is there? You must have it on for so long. So yeah, that's really, really good advice. So I hope that helps Kate answer that question.
And we've had another a question come in from Meg, and I do feel for you, Meg, here. She said, my mum has got a 1.5 centimetre lump and another smaller one in her boob, and she's had a biopsy and she'll get her results on the 15th. I'm absolutely terrified. I know no one can say without seeing the scans, but is she better having a full mastectomy rather than a lumpectomy to prevent the cancer coming back?
And Meg, we absolutely understand, and you use the word terrified, and yeah, I get that. And we hear from many people that are waiting for results have that feeling of being terrified. Meg, I wonder if it might help you to ring our helpline to talk to one of the teams. Sometimes talking this through can really help. But it's really difficult to say, Meg, exactly what treatment your mum might need. If indeed it does turn out to be a breast cancer, just because your mum has had a biopsy done doesn't necessarily mean to say that it's going to be a breast cancer. But of course, we don't know the story so far, so it's difficult to say. So there are different ways that if this does turn out to be a breast cancer, Meg, that your mum will get the right treatment and your team will guide you. You said that your mum has a lump and another smaller one, so a lot of that depends on how big your mum's breast is and how far away these areas are. So Meg, do try and give us a call if you can, and it might be a little bit easier to talk this through. But whatever this turns out, we are here to support you and your mum, and it would be our pleasure to support you and talk you through this. So all the best to you, Meg.
Yeah, absolutely. And a lot of people do say, don't they, that waiting for results can be some of the hardest times.
Very much
because
so.
It's all that uncertainty, and it's completely natural for your mind to go on and start thinking of lots of different scenarios. But it's all sort of, at the moment, it's all the unknown and not knowing, and going down those pathways where you may not need to can be really tempting to do that, but also can be very difficult.
Very difficult, Katie. Yeah.
So managing that anxiety is really hard, but it's whether you've got any techniques that can help with that as well.
And that's something we can talk you through on the helpline with the team. So Meg, we're here for you, and thank you, Katie. Katie, we've had a question in from Sharon, and Sharon says, I have left, I think this means been left very lopsided after surgery, about 3 cup sizes. Sharon would like to go swimming, but she's extremely self-conscious. Do you know of anywhere that makes a partial prosthesis suitable for swimming? What a brilliant question that is, Sharon.
Yeah. And there are partial, lots of companies that do partial prostheses, and companies that do swimming prostheses as well, and companies that do special swimming costumes with pockets that you can put your prostheses in. So I think it'd be really, really helpful for you to maybe try and have a fitting with that. So talk to your breast care nurses about where you can have fittings done. Well, many hospitals do prostheses, most do. And do fittings after your surgery, and if that's something that you're interested in, then absolutely, there's no reason why you can't go swimming after surgery, and there are swimming prostheses that are specially made for lightweight. So I think it would be definitely worth talking to your breast care nurse and seeing whether they could book you in for a prosthesis fitting. And having a look. And again, we've got lots of information online about prostheses and about bras and swimsuits and those sorts of things. And at the back of our booklet, there is actually a list of suppliers. So I know you get one prosthesis for free on the NHS. Sometimes you do have to pay for the swimming prostheses on top of that, but I think that depends a little bit on where you are and what the policies are in your hospitals. So it's worth having that conversation, but there is definitely things available there.
Absolutely. And Katy, there's also, I don't know if you're familiar with these, but there are sometimes knitted knockers, they call them, that are again lighter, and they can be used for sewing, but they're all on our website and information about it. So do explore that, Sharon, and call us again on the helpline if you want any advice or anywhere where we can signpost you to talk it through.
Absolutely. Vic, Nadine has asked, I've recently finished a year of FESGO. Is it safe for me to take supplements? I want to up my vitamin B, my B vitamins to help my peripheral neuropathy, and dandelion and horsetail to help with the fluid I have in my breast after surgery and radiotherapy. I have a seroma and lymphedema. Thank you.
Okay, Nadine, it seems like quite a lot's going on for you at the moment, doesn't it? So when we talk about herbs and other supplements, herbal supplements, the thing is, Nadine, there isn't the evidence out there like there is with conventional medicines to say what's safe and what's not safe. And when we talk about safe, it's about actually whether they may contain some hormones such as estrogen that may actually be detrimental. So obviously, if you've had an estrogen positive breast cancer, what you don't want to do is introduce more hormone, more estrogen into your body. And we don't really know what these supplements contain because they're not regulated in the same way. Often people talk to their pharmacists to get some advice about that, and certainly on our website there's information about vitamins and supplements that you might find useful. There's also a website, the Memorial Kettering Sloan Cancer Centre. They have information about supplements. But Nadine, before you take anything, it's always best to talk to your treatment team because they're so much better at being able to say whether there is any interaction with the medication that you may be on and the supplements you're wanting to take. But it sounds as though you've got a seroma. So a seroma is a protein type fluid that often builds up in your breast after breast surgery, and your body will absorb it, but sometimes it takes longer to absorb than otherwise. So I wonder whether it's best talking to your team about that. I don't know, Katy, if you've got anything to add.
I would suggest having a seroma a year after treatment. So you've had a year of FESGO. I don't know quite when your surgery was, but I imagine it was some time ago. It might be worth talking to your team about that seroma if it's a persistent one. And you mentioned that you've got lymphedema as well. So I think, again, it's something that you have spoken to your team, and if you haven't, maybe talk to your team about that, and they can refer you on for some specialist advice regarding managing the lymphedema, and whether that's a massage or a sleeve that you can wear as well. And again, we have information about managing lymphedema on our website too. You can always phone our helpline if you want more information about that. But yeah, I absolutely agree with what you're saying, Vic, about the supplements and vitamins. And although people think that understandably they want to do as much as they can to help themselves by taking these supplements, you need to do it with a bit of caution because there are some interactions that you may not be able to take with certain drugs. So it's just being aware of that and talking to your pharmacy and talking to you and having a look on the Memorial Sloan Kettering site as well about things like dandelion and horsetail. They will be able to tell you whether they are contraindicated as well.
And we've got a very good YouTube video from breast cancer now with it's breast cancer and diet. So you may actually get something from watching that, Nadine, because really I think the thought is that if your diet, you have a healthy, balanced diet, actually you shouldn't need any supplements. But again, it's taking into account your circumstances. But if you want any advice as to where to find these videos, then again, do ring the helpline and we'll be able to guide you there.
Yeah, absolutely. And Liz O'Riordan, again, is talking about this exact subject next week as well. So it'll be worth tuning in next Thursday night if you're available. Or you can watch that or catch up as well.
Brilliant. Yeah. Katy, we've had a question in from Rachel, and Rachel's asking, she had more than one lump found when she had her mastectomy. So Rachel is asking, does that increase my chances of recurrence? I was considered stage 1A, but worried about 3 separate tumours that were found.
And that's really difficult, Rachel, isn't it? When you find things that you weren't expecting when you have your surgery and you have your results afterwards. I mean, I think the important thing to remember is that if you've had a mastectomy, those lumps have all been removed. So they will have, hopefully have given you clear margins as well. And your treatment team will be able to talk to you about that and about the pathology that was found. And if they were removed, whether any other treatment was given to you afterwards. And the chance, the reason you are given any extra treatments if you need it is to reduce that risk of recurrence, and that's when the cancer comes back. And for most people the cancer doesn't come back, and that's the thing to be really aware of. So if you were considered a stage 1A, then that sounds like that was a very early cancer. It's very difficult to sort of give statistics with just that little bit of information there, but it's something to talk to your treatment team about, and they'll be able to tell you if you wanted to know a little bit more about the risk of your cancer coming back. They will be able to talk you through that as well. But it's remembering that any treatment that you have, the surgery will have removed that cancer, so that cancer should have gone, and any extra treatment that you have is to reduce that risk as much as they can about the cancer coming back. And whether that is hormone therapy or chemotherapy or radiotherapy, or whether they decided actually that the cancer has all been removed and no other treatment is needed, is all tailored to you to reduce that risk of recurrence as much as possible.
Absolutely. And if they're 3 separate tumours, they will treat them as 3 separate tumours, won't they, Katy?
Absolutely.
So maybe one tumour needs that treatment, another tumour needs that treatment. So it's very much looking at the your individual pathology. That's right, Katy. Yeah.
Vic, Ellen has asked, my right breast is a lot plumpier than my left after my operation. The lymph nodes have been removed and I've had radiotherapy. Will it go back to normal size?
That's a good question, and again something we hear about quite frequently on a helpline and on our Ask Our Nurse written surveys. So once you've had surgery to your breast, Ellen, and treatments such as radiotherapy, it can alter the size of your breast, sometimes depending on the type of operation that you've had and the amount of breast tissue that's been removed. Some people say that their breast is actually smaller, like Sharon's question earlier. Radiotherapy can affect the size of your breast, and you can get some breast swelling after radiotherapy. And what we have to remember is that even when your radiotherapy treatment stops, it actually continues to work for some time. So it can take quite a while, Ellen, for your breast to sort of settle down. Now, whether it will go back to normal size, and I guess normal size means the same as your right breast, it's very difficult to say, obviously because it depends on the type of operation you've had, how much breast tissue. But certainly with the radiotherapy, if you have got swelling, it should settle down. Some people can get a lymphedema in their breast, which is a swelling of the breast tissue. So, Ellen, you've written that question in for a reason, and I wonder if it might be best just asking your treatment team just to check your breast, just to make sure that nothing untoward is going on. I couldn't possibly say that there is, Ellen, but there's no harm in checking, is there, Katy?
Absolutely, there's not. But it does take time, as you say, Vic, and often it can take some months before everything settles down. And we do get a lot of people asking as well, how to check their breasts after treatment, because they might find that their breast is a different shape or a different size to what it was before treatment. And it's just trying to get used to what's your new normal. You don't say how long after your radiotherapy you are at the moment, but often it can take, as Vic said, a few months for that all to settle down. And often people find that it may be up to a year sometimes before they feel that everything is settled and it is back to its normal size and what will be normal for you. So
yeah, good advice.
Yeah.
So I'm not sure if we've got any more questions in, but Katy, I just wondered if I could ask you a question while we've got this time together.
Of course, yeah.
We hear a lot of people often are confused or anxious about having to make decisions about their breast cancer treatment, and especially when it comes to reconstruction. So some people, we often hear on the helpline, "Oh, I've been asked I can have a mastectomy, or I can have a reconstruction, or I can have that later." So Katy, can you just talk us through what the options are? Say, for example, a person is needing a mastectomy. What are the options with reconstruction?
Well, that's a really good question, Vic, and it is something we get asked a lot because there are lots of options and it can be quite confusing. So if you have been advised that you need a mastectomy, I suppose the first thing you need to think about really is whether you want a reconstruction or not, because not everybody does. So a lot of people would decide actually that that's not for them, and they would prefer to have a prosthesis in their breast, in their bra instead. Or some people would decide not to have anything at all and to stay flat. So that is always an option as well. So being aware that that is something that some people may opt for, and you don't have to have a reconstruction. But if it is that you would like a reconstruction, then thinking about what your aim of that reconstruction is. So is it to have symmetry in your bra, or is it to have symmetry outside of the bra, and knowing what your anatomy is at the moment. So there are certain reconstructions that would be suitable for certain people and for your body shape as well. So the options are what we call an autologous reconstruction, which is using body tissue from elsewhere in your body. Often that's from your tummy, but it can be from other places in your body as well. And that's using your own tissue, so the reconstructed breast will be warm and soft and feel more natural. And some people would, but that's a bigger operation. It does give a very good cosmetic result, but it can take longer. Or whether you would prefer to have something which is maybe a quicker operation and will give you the symmetry in the bra, and using something like an implant-based reconstruction. And those types of operations do tend to be quicker, and they can give good symmetry, but they're not suitable for everybody, and they're not suitable for everybody's shape. So there's a lot to consider with that, and also to consider whether you want a reconstruction immediately or whether you would prefer to wait to get your treatment out of the way, and to consider that as a delayed procedure. Mm-hmm. And also what other treatments you might be offered in the beginning. So if you know that you're going to be offered radiotherapy, for example, it might be that an implant-based reconstruction isn't something that would be recommended for you in that instance. So it's a big conversation, and it's something that you really need to think about what you want to, where you want to go with that, what you're sort of hoping to achieve, and have a look at photographs if possible to see what a reconstruction type surgery is and what the recovery is and the impact that will have on your life. So
I think you've demonstrated, Katy, that it is complex, isn't it, and often support is needed, and that Breast Cancer Now breast reconstruction information booklet has just been updated. So again, it's a really, really good read in clear, simple language that will help if any of you are considering or a reconstruction, be it immediate or delayed. So do recommend that.
And Nancy has asked, I had a lumpectomy 2 years ago with a re-excision for a clear margin. I then had 24 radiation treatments. It is now smaller with scar tissue. What is the best way to deal with the scar tissue? I've just had a mammogram and that was very painful, but it was all clear, which is good to hear.
Yeah, I was going to say, yeah. Katy, it's good to hear that it was all clear, Nancy, but really hard if that mammogram was painful. Mm-hmm. And we know that scar tissue can happen after an operation, and especially, Nancy, if you've had 2 operations, it's difficult really to know how you can deal with the pain of scar tissue, because obviously it's within the breast. Sometimes massaging the breast can help, but I couldn't say that would be highly successful, but it may be worth considering. When it comes to having a mammogram, I think it's certainly worth talking to the mammographer that you have to say, look, when I had my last mammogram, it was really painful. And it's so important for anyone that struggles having a mammogram, because of pain or discomfort, to talk to the mammographer team. And the way that they can apply pressure can be slightly different. I'm not a mammographer, but I'm familiar that they can do different things. So please do talk to your team as well.
And sometimes actually taking some simple analgesia before
Absolutely.
you have a mammogram can be a good thing to do as well, because even something like paracetamol, if you can take it, and again, that's not something that we would recommend without talking to your treatment team about, but sometimes that can help with managing that discomfort.
Yeah, I think we forget that, don't we, Katy? You know, actually to take some pain relief before you have a mammogram. But and Nancy, again, if the pain in your breast is really uncomfortable, it's quite reasonable to talk to your breast care nurse or your treatment team and just have a discussion about it, just to check that there's nothing untoward causing the discomfort that you've got. So. Katy, we've had a question from Wendy. So Wendy says, I had lobular neoplasia, so a lobular breast cancer in one breast, and then a year later, a stage 1 cancer in the other breast. So Wendy's asking, how likely is it that these are connected? Basically meaning that, was it obvious she'd get a cancer diagnosis?
Okay, Wendy. So lobular neoplasia doesn't necessarily mean it's a cancer, does it? It can mean that it's the changes before cancer, or just changes in the way the cells are dividing. And the fact that was in the other breast, I would say that they may not be connected at all. So it sounds like if you've got something in one breast and then something in the other breast a year later, they could be two incidental findings, really. It's difficult to know. It's difficult to know if because we don't know what the other cancer was in your other breast and how that was connected. But I would say if you've got something in one breast and then something develops in another breast, it could be that they are two separate incidents. Again, I think it's something to talk to your treatment team to say, because they can look back as well at if you've had any previous mammograms and things to see whether there was anything there, and they can do that as a sort of a retrospective look to see at your mammograms as well. But it doesn't necessarily mean that was a foregone conclusion, I would say.
Yeah, absolutely.
And we're coming to the end here. I know there's a couple of questions that come in. I think if we can just answer, Janine has just asked one, and then I think we may have to finish. But Janine has asked, I've been diagnosed to a private clinic, but my health insurance doesn't cover all treatments. Can you cross back to the NHS after starting private treatment?
Oh, hi, Janine. Yes, you can, in short. And we often hear from people that start maybe having investigations through the private healthcare system. But then, like you say, the insurance company doesn't cover all treatments. So yes, you can cross back to the NHS and just talk to your treatment team about how best to do that. But absolutely, you will be able to get treatment. Take care, everyone. Bye.
Bye-bye now.